My name is Ashok Dialchand. I represent Institute of Health Management, Pachor Ashish Karam Rachna Trust. Our journey began in 2003 when we decided to work with married adolescent girls. A lot of people asked us at that stage, why married adolescent girls? And the answer was really very simple. They are at much higher risk. They have least access to health services. And to our perception, they are the most invisible group in this country as of today. What is the number, what is the proportion of girls getting married before 18 years of age? For the entire country, on an average, more than 45% girls get married before 18. In Maharashtra, rural Maharashtra, it's as high as 50%. But averages hide more than they reveal. In Maharashtra, the variation is as low as 4% for some districts and as high as 70% in the high-risk districts. And what are the consequences of early marriage and early conception? Clearly, and there is a lot of literature to this, the maternal mortality rates, the infant mortality rates are anywhere between 3 to 5 times higher as compared to women more than 20 years of age. Low birth weight babies is 3 times higher, 2 to 3 times higher. The prevalence is much higher in girls as compared to women. Spontaneous abortions or miscarriages is higher. Domestic violence is higher. Reproductive tract infections are higher in girls as compared to married women more than 20 years of age. So those are the consequences, main consequences of early marriage and conception. How many of us really in this hall would even conceive of allowing their girls to get married before 13 years of age, having a couple of abortions or miscarriages before they reach 18, or having a couple of live births before they reach 18 years of age? Well, ladies and gentlemen, there are 113 million girls 10 to 18 years of age in this country, and 51 million will become mothers before they reach 18 years of age. How can we protect these girls from the adverse consequences of early marriage and early motherhood? Well, our institute demonstrated 5 really simple interventions on how to mitigate the adverse consequences of early motherhood. We work through ASHAs, and what the ASHAs do is, these are community health workers in villages, they visit every household once a month. During that visit, they assess the health needs of these girls. They detect morbidity, if there is any reproductive morbidity during those visits. They provide interpersonal communication and counseling to these girls and their families, including the decision makers. And they do micro-planning and provide the micro-plan to the health providers. Most importantly, they actively link these girls with health providers. What impact has it had? The impact of all of this, and one of the key things, really, one of the key interventions is capacity building across the board. What I want to emphasize is all these interventions were done through ASHAs and ANMs. What impact has it had? We've had an increase in median age at marriage, an increase in the interval between marriage and first birth, a significant increase in contraceptive use, increase in maternal health services, as a result of which maternal morbidities came down. The low birth weight babies, the prevalence of low birth weight babies came down substantially. The treatment of RTIs went up very substantially, as a result of which reproductive tract infections, the prevalence of STIs, sexually transmitted infections, and RTIs came down. Now, what is the need to do in future? The future, we feel, we've compartmentalized unmarried adolescent girls, married adolescent girls, and women, and have totally ignored boys and men. What we need to do is, what we are trying to do as an institute, is integrate all of these components for a synergistic impact. Delay age at marriage for unmarried girls, delay age at first conception for married adolescent girls, take care of their health needs, and make young men more sensitive and more gender sensitive and responsive to women's needs. Is this feasible? Well, I will say that we have 900,000 ashas, trained ashas in this country, 150,000 ANMs. It is imminently feasible because this was done through this particular human resource. Before I relinquish this podium, I would like to say a few thanks. I would like to thank ECHO, Christian Aid, Ford Foundation, who way back in 1996 initiated this course, initiated our institute to work with adolescent girls. Since 2003 to date, we've been supported by MacArthur Foundation for this work of health of married adolescent girls. My very sincere gratitude for this sustained and consistent support from MacArthur Foundation. I'm a mere spokesperson, ladies and gentlemen. The real people who have worked at the grassroots, and I will ask them to please stand up, Ms. Manisha Khale, Mr. Mohan Koshi, and Mr. Gopal Kulkarni. They are the real change makers. I would like to thank our girls, their parents, the stakeholders in our communities. You will not believe it, for 10 years, we've invited these girls to our institute. We've invited them to Aurangabad, Mumbai, Delhi, Singapore, as far as Washington, and never once has parents said, no, we can't send our daughters with you. Lastly, a word of thanks to Dasra for this great, very great honor. Thank you.